There are four major types of thyroid cancer: papillary, follicular, medullary, and anaplastic thyroid cancer. The most common type of thyroid cancer is papillary thyroid cancer. It makes up over 80% of thyroid cancer, and with proper treatment is considered to have the best overall prognosis. The other three types of thyroid cancer occur rather infrequently. Follicular thyroid cancer similarly has a favorable outcome with proper treatment. Together, papillary and follicular thyroid cancer are called thyroid epithelial cancers because they come from cells that are responsible for making thyroid hormone, which is essential for regulating metabolism. Both cancer types are termed differentiated thyroid cancer because they take up iodine and grow in response to thyroid-stimulating hormone, TSH. These characteristics allow them to be treated with radioactive iodine and TSH suppression therapy after surgery when clinically appropriate. In addition, the hormone known as thyroglobulin is a very useful biomarker to monitor for recurrence of differentiated thyroid cancer. While there are certain varieties of papillary and follicular thyroid cancer that are more difficult to treat, called tall cell papillary thyroid cancer and hurdle cell follicular cancer, generally papillary and follicular thyroid cancer have a very good outcome. The other two types of thyroid cancer, medullary and anaplastic, cannot be treated with radioactive iodine and TSH suppression. Medullary thyroid cancer arises from different cells in the thyroid gland called parafollicular cells, or C cells. Instead of making thyroid hormone, they make another hormone called calcitonin, which controls calcium levels in the blood. In this form of thyroid cancer, calcitonin is a useful biomarker that allows physicians to monitor for recurrence of disease. Medullary thyroid cancer can occur spontaneously or be genetically inherited. When inherited, it is often caused by a disease called multiple endocrine neoplasia syndrome. This condition can involve tumors in other endocrine glands, such as the parathyroid and adrenal glands. The overall outcome of medullary thyroid cancer often varies depending on how far it spreads beyond the thyroid. Patients may require additional treatment for the spread of cancer outside the thyroid to the lymph nodes or other structures. The last major type of thyroid cancer is called anaplastic, and it is a much more aggressive form of cancer. The cells in anaplastic thyroid cancer divide very rapidly, leading to a very significant growth rate. Patients usually experience a sudden and rapid growth of their thyroid gland and may also experience paralysis of their vocal cords, as well as invasion of the airway or esophagus. The diagnosis of this form of cancer is considered an emergency and requires immediate workup and treatment. Treatment usually involves surgery depending on the extent of the disease when it is diagnosed. Surgery is usually followed by external beam radiation and chemotherapy. Unfortunately, the life expectancy in this aggressive and unusual form of thyroid cancer is usually very short, despite the use of extensive multimodality treatment. Besides the four major types of thyroid cancer, papillary, follicular, medullary, and anaplastic, there are other rare types of cancers that can grow from within the thyroid gland. Other types of cancer, such as colon or kidney cancer, can spread to the thyroid. Lymphomas can also grow within the thyroid gland. For this reason, whenever a diagnosis of thyroid cancer is made, it is important to see a physician that specializes in thyroid disease to ensure an accurate diagnosis is determined and an appropriate treatment plan is established.